Welcome to the Menopause Stories podcast. I'm your host, Dr. Tamara Beckford, founder and medical director of Truly Balanced Wellness Care. This is the space where we stop the guesswork and start the optimization. We're pulling back the curtain on that midlife hijack and giving high-achieving women the clinical roadmaps and unfiltered stories they need to reclaim their edge. Let's get into today's story. Come back. I am so excited that you guys decided to join us again on Menopause Stories podcast. Alrighty, so I have a wonderful guest today. Is Dr. Alexandra Gajer. I'm going to have her introduce herself, and then she's going to tell us a little about her story. Because, ladies, we all go through it. I've had like some of my colleagues on here, and the reason why is to let you know that no matter what phase in society that we are all women. And guess what? Once we hit those 30s, 40s, and 50s and 60s, we're all going through this process called menopause. And I want you to know that you don't have to be alone. All right. So listen to our stories. I hope you learned from it, and I hope you enjoyed today's episode. Alrighty, Dr. Alexandra, go ahead and introduce yourself and tell us what it is that you do.
Yes, thank you so much. So I'm Dr. Alexandra Gajer. I am the physician owner of the Gajer practice, where we work with both men and women on health optimization through optimizing metabolic health, hormone health, and performance through peptide therapies and other medicine strategies. And I'm really excited to be here. Thank you for having me.
Alrighty, I am super excited that you're here. One of the things that's happening now is, like we said, the peptide regenerative and hormone therapy. It's really bringing a bigger awareness to what's going on. And I know your practice helps men and women. And it's so important because guess what? We're all going to age. But we're going to talk about that 50% of the population, which is us women.
Yay.
And about some of the things that we go through. Now, have you yourself experienced anything on this journey called perimenopause? And if so, tell us something that was just like, okay, you won't believe this, or girl, let me tell you.
Yeah, absolutely. I love being right alongside my patients, and I'm on the early side of things. I'm 44.
Yeah, we call it the
perimenopause, 100%. Yeah. And, I think this is so interesting because I think that peri and menopause can be so sneaky, and even for me, I'm working in this field. This is what I do. I talk to women every day about their symptoms. And I myself have gone through having Lyme disease and PCOS during, my reproductive years. And I always attributed a lot of symptoms to that. And I actually was on a podcast with one of my colleagues, and I said, can I see you as a patient? And we kind of went through some of the things that were happening with me. And she's like, you could probably start some estrogen now. And it was like, I started a low dose estrogen patch, and all the muscle aches that I was having and the difficulty with training and some of the low-lying anxiety, it was gone. Yes. And I've seen it happen in so many other women, and it's amazing how we can have these blank spots in our heads of like, well, this is just the way I am. It was probably from the Lyme that I used to have and like all this other stuff. And I think it just proves how sneaky those hormonal transitions can be and how we get used to living with things as women and like don't necessarily see that this could be part of that journey.
Absolutely. I think you have hit the nail on the head. A lot of us, and especially, we'll talk about this from two perspectives, right? So, one, woman overall. Okay, a lot of us overall, we go through life, and as we transition, our load becomes heavier and heavier. But because we're just so used to trotting through, another layer comes on, and we're just like, okay, let me just readjust and continue pushing through. And then another layer comes on and we says, okay, wow, this is getting really heavy, but I'm just going to readjust a little more and keep pushing through, and not realizing like, whoa, all of this could be related to some other changes going on. So that's from like just being a woman, period. Now, being a clinic is so crazy because if I were to sit down with you, Dr. Gajer, and say, we have a let's say middle age, like 8-year-old female who's coming in with symptoms A, B, C, and D, immediately you'd be like, oh, yeah, no, this is going on. But when we are said patient, we don't see any of this because we start attributing it to so many other things in our lives. And you're not the first physician. We had a reproductive endocrinologist, Dr. Erica Bove, and she said the same thing. And mind you, she's like, I went to school for OBGYN and fertility, and perimenopause still snuck up on me.
Yes, I know. It's crazy.
Absolutely, absolutely. You went and you sought help from a colleague. Now, the biggest thing is when you got to that realization, you were just having this conversation, right? What started to just ping in your mind, like, whoa, wait a minute? Or was it the colleague that was looking at you like, okay, now, Alexandra, now you know?
I think it was a combination of things. And yeah, and also just having somebody else's perspective and,
Mhm.
not kind of just living in your own body. And most doctors don't pay attention to this, but it was a conversation and someone else seeing me clearly and like the
Mhm.
muscle, those micro tears in your muscles that estrogen fixes. I always thought that was just from the Lyme that I used to have,
Mhm.
and it's miraculous sometimes when we have the right hormonal support, how much better things actually can get.
Absolutely. So you were having what we call the musculoskeletal syndrome of menopause. So a lot of like joint aches, body aches. How was that affecting like your day-to-day life?
Yeah, I consider myself fairly athletic,
Yeah.
and the active part of my life is something that brings me a lot of joy, and it's really
Oh,
important for my stress management. I do a lot of yoga. I
yes.
enjoy biking and weightlifting and all those things. And it was limiting the amount that I could do, whenever,
Mhm.
especially my shoulders and my back, whenever I did a lot of upper body work, I had to take a break for much longer than I wanted to.
The
And
period,
the
right?
recovery period was so much longer, and I just felt like I couldn't do all the things that I enjoyed.
Mhm.
And yeah, it was a real breakthrough when I got the right treatment.
One of the things that you're mentioning also, which is like the recovery period, and you're discussing that you've had Lyme disease in the past. So, in your mind, whenever you start having any discomfort or so, our brain just goes to say, oh, well, remember that thing that, happened in the past. Like, no, this is not related to something else. It's possibly related to that. And we're not realizing like all the phases because are you having recurrent Lyme related issues, or had you gone through that and you were like,
Yeah, it's interesting. I
Mhm.
have had a long journey with it, and there
Uh-huh.
have been seasons when it's come up again, and then
Mhm.
seasons when it's changed. And I
Yeah.
think the way I understand it now is that I think the way my hormonal milieu, what my body is producing, changed the way inflammation was showing up in my body.
Yeah. That
So
girl estrogen, I'm telling you.
yeah, exactly. So luckily, right now, I don't
Mhm.
have any more Lyme symptoms, but I've gone through periods of time. Yeah, and who knows?
No,
But
no, we're gonna keep it that way. We're
yeah,
keeping
we're keeping it that way. But
yes.
there's definitely been time periods where strange things have come up.
The beauty about this whole thing is like you said, you were conversing with a colleague, you asked if you could be seen. The colleague was very objective because a lot of the times,
Hmm.
we're very subjective with ourselves. You had an objective opinion and you discussed it and you came to an agreement that like yes you're willing to start the estrogen therapy and you were feeling better and you're having
Yes.
some relief of all of this ache, so your recovery period is back to a normal recovery period from doing the things that you love, which we know is just so important for
Yeah.
longevity overall. So now in your practice, because this is you going through this as an expert in longevity and having this practice that you're taking care of men, but today we're talking particularly about the women in this phase of life. So in your practice, what are some of the things that you're seeing from your patients who are going through this midlife journey that
Yeah.
they might not even be aware of, but now you're saying like, hey, listen, this is some things that we need to keep in mind.
Yeah. First of all, I just want to say it's such a fulfilling place to work, as I'm
Yes.
sure you know,
Yeah.
because we have real solutions to offer women. So I get women in different time periods. I get some women who are coming in at that perfect time period where those symptoms are just starting to come up and
Mhm.
luckily online and on Instagram and on socials and everything, this conversation is happening. We're talking
Yes.
about women's health,
Thank
which thank God, our
God.
mothers, our grandmothers, nobody was having this conversation. And,
Mm-mm.
even when I went through medical school, my training, and I trained in emergency medicine, so different
Woo-hoo,
field. Yeah.
EM for life, in
Yes.
addition to everything else we do.
Yes, exactly. Yeah, but most of the complaints that come up in my clinic now, what I was trained to prescribe was reassurance.
Right?
We would tell people this is normal, this is what aging feels like.
Yeah.
And
Yes.
that's the least helpful thing
OMG.
and it is just so cool to practice medicine in an age where it's like modern medicine bought us this extra 40 years of life, but
Mhm.
now we know how to make those 40 years feel really
How
good,
to live.
Yeah. So I get women at all stages and phases, some women going through it early, just kind of having that question, is this my hormones? And then we
Mhm.
try to give them potentially minimal effective hormonal support to kind of keep the body optimized. Some women are
Mhm.
late in the stage. Some women are
Mhm.
coming in saying, have I missed my window?
Mhm.
Some women come in saying, I'm on synthetic hormones and I don't feel that great. And now I'm a little
Yes.
worried.
Yes.
And I had that conversation with a woman yesterday. And
Mhm.
sometimes I'm still surprised that that's out there,
There.
but
Mhm.
it is.
Mhm.
Full
Yeah, no,
spectrum.
it's a as like EM to EM, we completely understand our training and
Mhm.
we and it's so interesting too. So people ask us, I'm pretty sure you get this. They're like, well, so you like that super adrenaline, da da da. Yeah, I do, but I love this connection that I'm
Mm,
getting with these people, getting the time to really connect that you don't get as an EM doc. And
mhm.
also you're getting the time to see the progression. And I know all you other specialties out there, you're like, ha ha ha. That's why we do
Mhm.
what we do. Yeah, but I feel like us being able to connect in this particular way with our patients the way that we want to, with less time frame, more than the 7 minutes, and cramming in that 15 minutes, there's this joy of being able to support these people through this time. And I feel like it helps to fill that other void that we have, in our hearts as clinicians, as people who really, really want to serve, who really want to
Yeah.
help. Because I see the gap that we have in the training in medicine, and I see also the where we as physicians, when we took our oath, when we went out there to help and to support, and to be put in a place where you're not able to do what it is that I see the
Yeah.
Alexandra, you're killing me. You're like, girl, you're giving
Yeah.
where we're not able to do what we went out there and were trained to do. And it's out of things that's when you're in certain situations, it's out of your control.
Absolutely. You're speaking my experience exactly, and
Yeah.
I went to medical school with a deep desire to help people
Hmm.
and I wanted to make a difference in people's lives and although I'm super grateful for the years that I got to practice emergency medicine and everything I did there, in the last several years it just felt like this is not it. I'm putting a lot of band-aid solutions on chronic illness and you know I feel like I felt that I was falling short in a lot of ways
Yeah.
and now I think getting to understand the science of perimenopause, menopause, walk through women through this transition, it's just such a beautiful healing journey. And you talked about having time, having time
Yeah.
to spend with patients. And that's like so beautiful when
It's
women
so beautiful.
yeah, and I think, of course, we have all this modern therapy, which is so wonderful, but I think even being able to have a relationship with a clinician who cares about you and who'll walk you through this is, I think the relationship itself can be so therapeutic.
Absolutely.
And we
Absolutely.
need
But
it too. Yeah.
yeah. Absolutely. It's true. It goes both ways. And one of the things I'll say for all our patients out there, it is so rewarding for us to be able to sit down and to really deeply listen to you and to what's going on in your lives and how it's affecting you. Because there's, we say this, the bio, the psychological, and the social aspect. There's so much more to you as a patient other than I came in and I am having brain fog. Okay, tell me a little bit more. Just hearing the why behind it. And we know, yes, we know that there's the hormonal shift that's going on in your body, but being able to sit and listen and hear about like the psychological and the social aspects that's also contributing to that. So figuring out, like, we do have an idea that, yeah, this is the chicken, but the egg that's being laid as a result of all of this, it's affecting more than just X aspect of your life. So to be able to come up with a plan to help you overall as a human, and it's not just slap this estrogen patch on, good job buddy, we'll see you
Right.
next. There's more to it, and I think that that's what Dr. Gajer and I seem to have in common. That's why I'm sensing it. I'm super sensitive, and
True.
I'm sensing that that's what we have in common with wanting to provide optimal care for our patients. It's not just like, okay, I want you to feel better. Well, how can we get you to feel? Because better is probably where you were like at baseline when, well, how can we get you optimized where you're like, oh my God, finally,
Yes.
like finally, like
Yeah.
the clouds have parted. Like literally am seeing the sun. And I
Yeah.
think with some of that, it requires this time aspect, which we say, and then also being aware of what's going on in your body and providing that. So now in your clinic, Dr. Geyer, you mentioned that you also deal with longevity care. So tell me a little bit more about what are some of the things that you've added to optimize the care and what you're seeing that's working, because I want to make sure that my people are good too.
Yeah,
Yeah.
absolutely. Yeah. So, and again, we talk about, we have modern medicine has actually accomplished a lot to,
Hmm.
until about 100 years ago, our lifespan was about 45. Most
Hmm.
people maybe
Hmm.
150 years ago, but we lived till 45. So now we live till 80, 90, which is amazing. But how can we make sure we live long, but also live healthy, live in
Hmm.
bodies that are able to care?
Real talk, ladies. You've been Googling your symptoms, bringing your labs to your appointments, and still leaving with everything looks fine. It is not fine, and you know it. That is why I created the Hormone Manifesto, a 60-minute course that teaches you exactly what your hormone lab means, what optimal looks like for your body, and the exact questions to ask your provider at your next appointment. 6 modules, a clinical reference guide that you get to keep forever. Available nationwide for just $97. Grab it at go.trulybalancedwc.com/the-hormone-manifesto. Link is also in the show notes. Now back to menopause stories.
Areas through those things we love, bodies that are able to connect with other humans, bodies that can stay in motion, that can
Mhm.
have those experiences that bring us joy. So, I focus on metabolic health as a foundation. When I think about metabolic health, it's certainly not just weight. It
Mhm.
is very much how your body processes the food that you put inside your body. Can we
Mhm.
use food as fuel rather than store it as fat that's causing a lot of inflammation? Are we building healthy muscle, which is really the currency of longevity? We know that women who have healthy muscle feel better, have less chronic illness, live longer. So those are some of the foundations. And I work with a nutritionist in my office, and we want to make sure that metabolic health is intact. We, of course, layer the hormone health on top of it. Healthy
Mhm.
hormones are critical to a long and healthy life, for strong bones, for avoiding frailty, again, keeping you active, keeping your brain sharp.
Mhm.
And then for some people, we also work with peptide therapies where it's
Mhm.
appropriate. I work with a lot of women who've experienced periods of really intense stress and maybe have some burnout going on where their energy is crashing, and we need
Mm-hmm.
to support mitochondrial health to kind of get that energy back so they can even start thinking about building some of those good habits around exercise and sleep and stress management and food. And some people are fighting genetics that is causing them other issues that
Yeah.
are hard to change just through lifestyle.
Mm-hmm.
um, and I work with a lot of women who are dealing with a lot of inflammation. We live in this chemical environment now that our
Right.
body's never seen before. And
Mm-hmm.
we know that women get the most autoimmune illnesses. Yeah,
Preach it, preach.
absolutely. Like
Yeah, mine
we're
happened during residency. It's just like,
yeah, I mean, I got Lyme during residency, which is not autoimmune, but still
no,
like,
yes.
yes. So
Mm-hmm.
so I found peptides very helpful when it comes to balancing inflammation
Mm-hmm.
and sort of optimizing performance from that standpoint.
Mm-hmm. You mentioned something that was so important in this aspect too. When you have like some women who are going and experiencing this phase, and some it might be during this perimenopause menopausal phase, but overall they're experiencing this exhaustion where and it comes off as also burnout. It comes
Mhm.
out as just like pure exhaustion, and we know that we're trying to help to get, and we'll provide like, okay, well, these are the things that you need to do, which is an action word. And they're just like so exhausted. You can't even get to the action steps, the doing part. And you mentioned you support that with some of it. And I'm assuming that the mitochondrial support system to just get even just enough gumption to even just start
Yeah,
because the thinking comes before the doing. And
exactly.
and so to even be able to think and just to get a little
Mhm.
bit of to just get the engine started.
Yeah.
How are you seeing what are some of the like that you are providing, and what are you seeing that's
Mhm.
working, that's helping these women during this portion of that journey?
Yeah. I think what you said was really important. And I think a lot of women carry a lot of shame about that, where,
Mhm.
I think that's like one of the most damaging things that medicine has done to us too, is that we live in this environment that creates some of these symptoms, and women feel like it's their fault, and, and maybe they can't come in and get health until they're resistance training 3 times a week and eating 100 grams of protein every single day and getting
Yeah.
8 hours of sleep. And it's like, well, have you seen my life? I also have this job and these children and this
Mhm.
house and this husband. And
Yes.
so I want to emphasize this, what you said about, we love meeting women where they're at. Like, it's
Mhm.
okay. We get
Yeah.
it. Life is messy, and like, you don't have to be perfect to start. And
Mhm.
sometimes we need some biochemical support, whether that's hormonal or,
Mhm.
or metabolic or a peptide that will make some of those habits possible. So, but for women who've experienced real burnout and are exhausted, first, I try to understand where that exhaustion is coming from.
Mhm.
And sometimes, and I think one big thing we talked about is inflammation. And the number one
Yeah.
symptom of inflammation for some women is just tiredness and
That's
fatigue. And
expected.
and I will sometimes look at the gut to see if there's a source of inflammation that we need to take care of. But then we also use some peptides, and peptides are an emerging therapy. And
Mhm.
unlike hormones, there's far less research on peptides. So I try to be
Yeah,
very careful when I offer this to patients, and we have kind of a risk benefit discussion for their individual case.
absolutely.
And usually, sometimes we'll use an anti inflammatory peptide like BPC 157 for about 2 months to just really target inflammation and try to improve those energy levels. And often a short course is enough. And there are some mitochondrial peptides and coenzymes like NAD is
Mhm.
a,
Mhm.
a micro cofactor derived
And
from
for those of you
vitamin
guys who love the
B9.
Krebs cycle, remember that thing that kept
Yeah,
jumping off that
exactly.
Krebs cycle?
Yeah. So understanding how we produce energy, NAD happens to be one of those cofactors that's limited in our bodies as we get older, and
Mhm.
replacing that for some women can really improve energy. And then there are emerging peptides like MOTS-c, which I really love in women whose energy is really crashing in the menopausal transition. And that cleans up the way the mitochondria is working and can actually increase the number of mitochondria in your cells. We usually do it for 1 month, short course, and it can just be a little up level so that energy returns and you have some of that life force that can make you happy.
One of the in having a different modalities to help to support women during this change is phase in life. Well, one of the things that we have to keep in mind, women, and I hope you keeping this in mind, is that once you get to this perimenopause and menopausal phase in life, you have gone through a lot, and you probably have a lot on your plate that you're juggling. You're probably not giving yourself enough credit for all that you're doing, because it's just Tuesday. That's just what I do. And I know, because I talk to you all and I tell you when I listen, and I'm also on the same side, but I am acknowledging it. I'm ready to acknowledge, like, yeah, I am, I have done a lot, and I, do carry a lot of load. But when I talk to some of you lovely ladies out there, you're not acknowledging all that you're doing. And so when you start to have this fatigue, or you're starting to notice some of the changes, and I start having you list, well, tell me, I will tell you that the first thing you said is, oh, well, that's not nothing, because I'm used to that part. Oh, I'm used to this. Yeah, no, it's not affecting my job. I'm used to having to do 50 million things at the same time, and da 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 da. I'm just upset that I can't do this right now. And I'm like, well, because this is the 50 million additional thing that you do. Yeah. Ladies, you guys do not play. You guys are carrying a lot of load. And so if you start to find that you're not able to do all that you used to be able to do, it's okay to get support.
Yeah.
You're doing a lot.
Absolutely. Wow. What so well said. What a fantastic point, and I think, and I'm sure you see this too, where we used to see this transition as a potential kind of big hiccup, where there can be that midlife crisis. But I think we're seeing more and more women seeing this as a revolution. Like, this is a time to take stock of our lives. And ladies, you are carrying a lot, the things that women are carrying out there. Wow, it's
you guys
amazing.
Are running organizations, you're chair people of you're doing your charity, you're raising money, you're raising your family, you're supporting your spouses, you're still doing so many things in every aspects of your life. And even, I know you might look and say, well, that person is a doctor, and so da 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 da, but I'm a housewife. Exactly. Thank you, Dr. Gray. You should see Dr. Guy's thing, like a housewife. Now, the ultimate micromanagement and the ultimate planner are our housewives out there. Let me tell
100%.
you, running that thing called a home and all the moving parts at the same time, that's no joke. That's literally organization within it. Thank you.
Yes. Yeah.
And so you also need support.
Yes. And I think the revolution is when we say, I need help too, where I've taken care of all these things. I've built perhaps a career, perhaps a family, a home but it's time. It's time to give ourselves a little bit of that love that we've been giving to everybody else. So I definitely want to empower women to start looking after themselves, because that's the best thing you can do for everybody around you as well.
Yeah, trust me, society needs us. If we're not here, they will collapse. Alrighty, so I love this. Now, I know that you're seeing a lot of your patients in your practice. You're helping to support them through that. Now, when you yourself was going through like thick of it, what song or lyrics of a song, it could be lyrics of a song, would you say epitomized what you were going through at that time?
All right. This is a great question, a tough one, and this is one maybe that not many people know, and I can't remember the name of the singer, but there's a song that it's called Life Goes On. And like the chorus is like, life goes on and on and on and on. And at that, there was a moment where I was going through a lot health-wise,
Mhm,
and I was
mhm.
doing ice baths, okay, which I think are
Mm.
awesome
Oh,
and
okay,
can be
good for
super
you.
helpful.
I'm
Yeah.
still trying.
So that was
On my German friends, I have some German friend ladies, and they will just dived right into the Mediterranean Sea. It was freezing color. I'm like,
yeah. So I would time that song was almost exactly 5 minutes. So I would time ice bath to that song. And it was sort of this epitome of like, yes, our bodies change, life is changing, but
yes,
life goes on and we roll with the punches and we find a way to make it great in all those different stages. So
I
that was
love it.
my little reminder.
Yes, yes. And I love two things that you just mentioned. One, the song that, you had a song to help you through that phase, which is the reason why I asked this question to all my guests, because I like
Yeah.
listening to music and it helps to change the mood. It's the ultimate quick mood changer and cortisol reducer for me anyway.
Me
And
too.
then
Oh yeah.
the second is that you're going through something that could potentially be very uncomfortable, but you paired it up with something that you liked, and you knew, okay, the song ended, your mind float away into the music while you're getting this ice bath, and then once the music ended, you knew that phase of this ended. That's number one. And well, actually, number two. Number three, we know that the ice bath is good for inflammation, but Dr. Beckford is still running away because she just can't deal with cold water. But one day, Dr. Gajer, one day I will be as brave as you and all my other regenerative medicine
We'll do it
friends.
together.
Yes.
Yes.
Oh my gosh, one step at a time. Okay.
Yes.
Alrighty. So where is your practice? And if there's one thing that you could tell me to help with something that you're seeing with your patients who are going through this menopause, perimenopause, and you're like, listen, Dr. Beckford, you should actually, add this to your repertoire to help these women, because I'm seeing so many great benefits in my patients who are going through this, and this will actually definitely add up to what you're doing with these women. What would that be?
Yeah. So I am located in Northern Virginia, right outside of
Mhm,
Washington, D.C. So we see patients at our two offices here in Burke and Vienna, Virginia. We also
mhm,
do a lot of telemedicine. We can do some telemedicine in most states. So
mhm.
we're at thegaierpractice.com online.
Yeah.
And let's see. I mean, this conversation has been so wonderful, and I think you're just so amazing.
Mhm,
I think one thing that's recently been in the forefront of my mind is
mhm,
understanding that while women go through these transitions, some
mhm.
are dealing with a level of inflammation that may be hindering their progress, and really
Mm,
looking for the root cause of
yes.
inflammation has been really powerful for me lately.
Mhm.
Looking for that in the gut. Sometimes there's a hidden dental issue or something going on for women who maybe the hormones are looking right now, but they're still not feeling 100%. That's kind of been my area where I've been trying to explore more and
Yes.
to find that root cause to help people set out on lifelong health.
Yeah, wonderful, wonderful. So dig in for a little bit more of our root causes, especially with inflammation. Inflammation is so prevalent. Like I'm not even gonna get into that part about like even just trying to have a meal. It's all these inflammatory induced substances in just a simple meal. So yeah, our bodies are actually going through a lot of inflammation. So finding ways in order to reduce the inflammation and our patients will add it to what's going on and add to how we're supporting our women through this perimenopausal journeys and add to the hormonal support that they're having. So I love it, love it. Alrighty, well, we have come to the end of this wonderful conversation. Well, I hope you had as much fun as I did. This was very, 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 very great. What's one last word that you'd love to leave with our listeners out there before you go today, Dr. Guy?
Yeah. Remember that this doesn't have to be a crisis, that this can be a revolution. Listen to your body, get your girls around you, get the support that you need. Self care is not selfish. Take hold of your life, make this a revolution, and make your next chapter really beautiful.
Absolutely. Make your next chapter your best chapter.
Yes.
And come in. Love it, love
Yes.
it, love it. Thank you so much,
Awesome.
Dr. Alexander Gajer, for stopping by the Menopause Story podcast. I know that you guys would have, if you've gotten this far, you definitely have gotten a lot of info. This is something that you want to send to all of your ladies out there, all your friends who are having the similar symptoms, or one that you kind of suspect that might be, having some symptoms, but she might be willing or maybe a little bit afraid of discussing it. You might just say, you know what, there's this really great podcast out there, and there was this great conversation on this. Listen to it and see if this might help. Because when you pass this on to the ladies in your life, you're passing on love and support because we're going through it, but we're not doing this alone. So, ladies, remember, we are out here to support you. And I do not take it for granted that you've taken this time to listen to me on this Menopause Stories podcast. Your time is one of the most valuable assets that you have, and I want to honor that. So thank you all for listening. Thank you, Dr. for jumping
Thank
on.
you. Thank you so
And
much.
my pleasure. And we will see you guys next time on the Menopause Stories podcast. Bye.
You've been listening to the Menopause Stories podcast. If today's conversation hit home, don't let your story stay stuck in that midlife hijack. Head over to the show notes to book your strategy session and to join the movement of women redefining their power. I'm Dr. Tamara Beckford. Stay optimized, stay bold, and I'll catch you on the next episode.